guys, how are you? Today we're going to be doing an intro video on how to create your CAQH account. Right now, what I have on the screen is the email that you receive from CAQH after you have registered. Once you register, and I'll navigate to that screen later, then you'll get this email once you have filled out that very high level information, your name, address, primary practice state. I started recording this video already, and then it got completely messed up. You couldn't hear my voice, so I'm just gonna redo it over so that you'll be able to hear me, obviously. And I should probably test out the sound because I don't know if I'm going to be doing this again and you're still not going to be able to hear me. So hopefully all is good. If it's not good, then I'll just go ahead and try to record this video another day. So, all right, let's jump into it. If you don't know me, my name is Kanisha Ward, and I am the senior credentialing and provider enrollment consultant with Cred Philosophy LLC. I have been doing credentialing and provider enrollment for about 10 to 11 years, so I'm still a newbie compared to some of my other colleagues. So I hope you enjoy this video, and I'm going to teach you how to create a CAQH account. All right, guys. So I'm already on here, and you can see I was already recording, but that failed, the recording, as we just talked about. So once you do that, once you go here, and I'll just open up another screen so you can have a visual. This is CAQH.com, so CAQH.org, I'm sorry. So when you are going in and trying to create your CAQH account, you want to go to CAQH.org. I love that they kept it simple. It's only 7 characters. So that's super awesome. So when you get here, you want to navigate, and I'll just show you the page really quick. It has some news stuff, white papers, just all about CAQH and their initiatives. So when you get here, you want to navigate to CAQH ProView. ProView is a free tool for all providers that needs enrollment. If you are a cash-based practice, then this video is obviously not for you. And if you are only accepting government, meaning Medicare and Medicaid, they don't integrate, so you actually don't need a CAQH account. CAQH is usually just only for commercial payers, or you have some Medicaid or Medicare Advantage programs that will accept CAQH, but if you're doing state Medicaid and Medicare, then you won't need to pay attention to the CAQH introduction. So we're going to navigate here. And then this is what it will look like. You'll have the whole overview of CAQH. Tells you here you got reference material here. Then this is where you would sign in. And then if this was your first time, then you would go here. So you go here and click register now. I did that in the before video, so I won't go back into that. And if I can, I'll upload the navigation tool so that you'll be able to see me navigate to that area. But I think it's pretty much self-explanatory, so I think you guys will be okay to be able to just go to CAQH and do what I just did. So we're going to go back to that email, because once you get this email, it is very, very, very vital. You won't be able to come here and sign in again, because CAQH only allows you to use one email for registration. So we're going to navigate back to that email. And if you guys have any questions on this video, please feel free to email me. My email address is KENTESHA@cred philosophy.com. All right, so now we're here to the email that CAQH has sent us. I know that because all of their subject titles usually say provider registration, and it'll come from ProView System Administrator at proview.caqh.org. So now we're here, and here's my CAQH ID. I already have it, and it only took about 3 minutes. So I'm going to copy that because I'm going to need that later. And then this is how CAQH ProView works. I know a lot of us are like, we fill out so much paperwork and we open so many emails, we kind of don't like to read our emails or read them thoroughly. So luckily, CAQH puts it all in the email and it's very easy to follow. And here you have the contact information and their the time they're available to provide any assistance to you. So now we're just going to go into the link and you're going to hit that link. And now it says, hey, you have a active CAQH. Awesome. So that's already in there for me. But if I didn't have it from the email, I can always just click back to my email. I'd be really keen and I'd already copied it anyway. So I'll just show you that. And then I hit continue. And then I'll have get started. Let's get started. So I go next. I don't need to read all that because this obviously is a made up MPI number that I made up. So right now I'm going to create my username and it's just going to be Cred Philosophy. I'm going to use this for training more, training on CAQH as they develop, because I am a very big advocate of CAQH. I like the fact that it reduces enrollment time periods. You don't have to think about a paper application. And even if you do have a paper application that you need to submit, if your provider already has a standing CAQH account, then you can download that information into a state mandated application. And some of the states that have state mandated apps are Texas, West Virginia, Colorado, so on and so forth. So I'm going to just make up a password here. You guys don't log into my test account. I promise it won't have any keen information that you're able to take. Just kidding, because it doesn't even put anything on the screen. So I just made me a password. And when you are creating your profile for your providers, or if you are a provider watching this video and you are creating a profile for yourself, please, please, please write down the answers to your security questions, because you don't want to have to scram around when you're moving from one practice to the other, or so on and so forth. You want to keep these in a sacred place, and we're all attached to these. So just do yourself a big, big favor and save yourself a phone call and just put it in your cell phone in your note section, email it to yourself. You guys know we can't keep up with sticky notes. So just email it to yourself, or no, I'm sorry, not email it to yourself, but save it in your notes or something in your phone as a contact or whatever. And then you'll always have that. So next, I'm just going to fill in some questions and make up some stuff. I did have a PT Cruiser for my first car. So that was my first car. And then I don't have kids. I won't use that. High school I attended was Yates High School. And my elementary childhood nickname. So now you agree to the terms, and I'm going to create my account. Now you want to see this. This is the screen that we want to see. I want to see that my profile was created successfully. So now I want to proceed to log in. And I already auto-saved that on my computer. So I have here my username and my password. So now sign in. I'm sorry, guys. I'm thirsty. Okay. This is new since the last time I logged in, this broadcast messaging. It'll tell you, I'm sure it'll tell you if they are down, and CAQH is down a lot these days. So if they have any outages, I'm sure it'll show here. But if you want to just get rid of that, hit dismiss. So this is a test. I don't know what that is. So I'm going to just dismiss. Okay, these are all, looks like all old messages. This is probably them testing their broadcasting system. This is a very important policy, but I won't get into that. I'll probably do that in another video. Come on. I'm sorry, guys. I don't know what's going on. Just go away already. Okay. We won't worry about that because I don't want to put you guys through any torture of how to get rid of that dismiss thing. So maybe it doesn't dismiss. I don't know. Okay, so when you first log in, you're gonna see this basic video, and you're gonna, I mean, not a basic video, but you're gonna see this basic profile, and obviously it doesn't have any information besides the information that I put into it prior. So that's this information here. I put in that I'm an acupuncturist. I'm not really an acupuncturist, so don't try to book me for services. So you'll see this. You'll see here is very vital. Profile data is incomplete. Documents are also incomplete because we haven't done anything. So, and we probably won't get to a complete status. I don't think, but I am going to try to walk you through it as much as possible because I am not a real provider. I don't know how it will react to me once they start doing verifications of anything, once you put in all the information. So my practice setting, we'll just put in anything. Right now, we're really just putting in anything. And then my primary address, email address. Here's an email if you want to put in your personal, if you want to use this for your work, whatever you decide to do. Now, I am going to make up a social security number because I obviously don't want to put my social security number on the screen. So see, it may or may not let me go to the next page. Sorry if you guys hear the noise. I'm in a hotel room, so. Okay, awesome. And let me go to the next page. But since my social is a fake social, it probably won't give me a complete status here because I didn't put in that correct information. But we'll try to run through this really quick and see. So next, once you save your personal info screen, you can click the ellipsis and it will give you all of these things, which we just saw on the first screen. But I'll just go into each of them. I actually won't go into each of them because I don't want to make this video unnecessarily long. So once you get in your CAQH, you can go through each section if you like. Okay, next, we're just going to go back to save and continue. It took my social out. That's one keen thing that they do. So here, got my state. Remember, I'm practicing in South Carolina. Do I currently practice? Yes. And I'm going to make up a license number. If you have multiple licenses and you are actively practicing in those states, I would recommend that you add all your licenses. Sometimes CAQH gets a little funky and it has this algorithm that they know you have that it knows that you have other active licenses. So it'll make you add those into the professional licensing screen. Do I have a DEA? Next, you'll go into the DEA screen and it'll pretty much tell you about do you have any DA licenses and all this other good stuff. So I'm just going to quickly go through this and just put anything. If you are a Medicare provider, you should put in your Medicare information. So if you are on any commercial plans that offer Medicare products, so such as, I can't think of one right off my head, but if you are even in Humana's Humana's network, and they offer a Medicare product in your market, then you would want to always put your Medicare information so that you can get those products loaded to your contracts. But I'm going to put no in this situation because I'm just going to put no. Do I have an ECFMG? No. I'm going to try to do this very basic because I don't want it to be long and drawn out, but I just want to take you through each screen of what you should and should look out for. So next we're in the education screen. I forgot to mention that next, once you finish professional IDs, you'll go directly into the education screen and it'll just walk you through each of these fields. So do that. I'm actually going to try to like save and continue all of this because I don't want you guys to have to do this. Specialties is a very, very, very vital area. If you want to be listed in the directory or if you are providing any group services or are you practicing in a clinic setting, you want to list your specialties. If you are a hospital-based provider and you are only providing inpatient services, specialties matter as well, but specialties matter. I don't want to put any red tape or anything. So specialties matter. Make sure you put specialties. Yes, if I'm going to put in, I have a specialty, and then I'm going to say that. If I'm board certified, that is very important. But I don't want to enter any information. So no. And then CAQH asks you if you're not certified, more about that certification. And then if you have any special experiences, special experience, skills and training, you definitely want to include it here because think of this as a repository for your information. When you are reaching out to a payer to get a contract, this is the method of, this is the source of truth. There's pretty much no paper anymore. The payers are going strictly to this method. So if you don't have an updated CAQH, you may want to email me because I can keep your CAQH updated for you. That way you won't have to worry about going in here. And we'll talk a little bit more about the reattestation headaches a little bit at the end of the video. So you have that. I'm sorry, guys. I'm just very parched when I'm doing videos. Now I'm starting to do videos. So I'm just very parched. I'm so sorry. I never really talk this much, but practice locations. I don't know if you guys know about the CMS address edits that are going to be in effect in April of this year. So April 2020. CMS has been putting this on the back burner for a while. It was going to go live in December. I believe it was December or December of 2019. But CMS figured, hey, we'll give you guys a little bit more time because there are a lot of hospitals and ambulatory surgery centers and urgent cares and etc. that have to capture each location that a provider provides services. They are getting really strict on this. You cannot just provide services and bill under one address because that is faulty billing. And I'm not a billing specialist and I don't present myself as a billing specialist. I would refer you to a billing specialist if you have any questions as far as how the bill should go out. But I am speaking from a provider enrollment perspective, and practice locations are key and they are vital coming forward. CMS is really cracking down on where are you providing services, when did you provide those services, and yeah, they want to know. So if I was adding a location in, I would go here to add. And right now, CAQH updated this. They made some updates to this, so it looks a little bit better than what it did before. And like I said earlier in the video, they are making active updates to CAQH to make it the source of truth, which is what we want it to be, because we don't want those redundant forms. We don't. Credentialing people, we hate them. We hate filling redundant forms. We just want to do this and be done with it. But I can't have my cake and eat it too, so I won't blab about that. Do I practice at this location? Yeah. I see patients all the time. And if you don't see patients there all the time, you can pick your status. If none of these fit you, you just hit other and explain why. I'm going to practice at the White House. I don't know the White House's address by heart, so we're going to just put in anything. Oh, Lord, I put Houston. You can tell I'm a Houston girl. Everything is about Houston. And I don't know the zip code for Washington, so this should do a UPS edit where they give me the name. Give me the correct address. Oh, come on. All right, so we skipped over that because I don't know the Washington zip code. Putting in any kind of tax ID. This is not a tax ID for any practice any of my clients. It's going to be a group. Is this the primary? Yes. Now, if you were a group and you had multiple tax ID numbers and you were at one location, but you bill different tens from that. I'm sorry, guys. I'm in my hotel and there was something weird going on outside. So if you were a practice and you had multiple tax ID numbers and it's not the primary tax ID for this particular 1234 Main Street location, you just hit no. It's no harm, no foul. So I'm going to continue. Hopefully this video isn't too long for you guys. I really wanted to give some great detail of CAQH because a lot of feedback I've been getting is that, we don't know how to utilize CAQH. What is CAQH? How long does it take? Now, it may take you guys much longer if you are a provider completing this because it's just extensive and long. You have to collect information that's not readily available to you. So you just want to be mindful that when you start, if you are an individual provider watching this video and you start to complete your CAQH, please have all your information handy dandy so that you don't have to scramble and look for it. And you always want to put the provider start date. So let's pause here for just a moment. So if you're a provider, you already have an established CAQH, you've already been working and you are moving to an additional location, you always want to put in your start date when you are starting with that actual practice or that clinic, that group, that hospital, you want to put in what day you're starting. So I'm going to just start on Monday, Always put that in because they look at this like your effective date. And if this is actively updated all the time, I'm telling you, it will cut down on so many of the calls. They call to update the provider directory. They call because they want to know if you're still practicing there. If you keep this actively updated, I'm telling you, it cut down on so many calls. So if you're a hospital or a large group clinic or any providers over 5, it is very complex to maintain for 5 or more providers, and you don't have a dedicated enrollment specialist. So just keep that in mind. Keep it updated. Just keep it updated. Think of it like your driver's license, even though your driver's license have to be updated every So years, you have to go to the DPS with active information, and This is in relation to your revenue. So you want to make sure you're doing everything that you need to make sure that you're still getting the money coming through the door. You want the money to come through the door, as well as patient safety and the quality of care is number one, but the money for your services is definitely number two, or in that ballpark number. Okay, so can right now we just talked about the start date. So I'm starting on Monday, and then my office type, you put that in, and then yeah, it can be sent. If information can't be sent to this whatever location we just put in up here, then you would just hit no, and you would put where you want it to go. Like if you wanted it to go to your home address instead of your group practice, you would put it there. This is my cell phone number. So if you guys want to chat and talk to me about something, I don't think that's a good idea. I have a business phone and I don't know it by heart yet. And I really suck at this. So we'll just put in anything. Sorry, guys. I don't know. I don't know it by heart. I suck at life. All right. So, yeah. If you have closed your practice to anything, go ahead and put yes. Although these questions don't have red asterisks next to them, this app is just so important because it will alleviate so many of the payer calls, guys. I'm telling you from first hand experience. I am a CAQH advocate, and I'm all about cutting down processing times. And we already know that the payers take 1,001 days to get our providers enrolled and linked. So we just want to make sure it's updated. I'm not paying attention to any of these questions, but if you are a provider and you do provide any of these, can't answer any of these questions, then I would recommend that you do so. Here, I skipped over a section. The practice office hours, you make sure those are updated. And then if you already had an additional address in here and we were just adding on addresses or practice locations, then you would be able to select from here and it will pre-populate this form. I'm going to put no because we don't want to put in any explanations right now. Here to ask me more questions about my practice locations. If you have mid-levels, definitely want to input this information. But for this time being, I'm going to put no. I was going to try to remove this to save time on the video, but CAQH is not being my friend for this. I'll just put in anybody's name. If you have practice limitations and you only see a certain population, then you definitely want to put yes to all these questions. If there weren't, you would just hit no and none of this. I don't think this would be a problem if you put no on all these. So we're just going to put no for the time being. But if you do have any of these limitations, go ahead and hit yes. If your age minimum is 18, 65, you want to put that in there because this is going to be very vital for the directory. We are losing so much money when it comes to administrative errors. We do not have accurate directories. So hopefully, I'm hoping in the near future that CAQH will be the all be all for the directory information, and we can send our patients to the right location without second guessing or anything. I'll say yes. All right, guys. You see how long this is taking? So, I mean, this does take some time to actually walk through all of this. And I'm not going to go through all of this because, I mean, I just don't have the information. And it's simply a data entry thing. So, if you have interpreters, definitely want to fill out that last screen. So now my one practice location is updated. So if you have multiple practice locations, you obviously want to add in every last practice location you can. And if you are a telemedicine provider, you definitely want to have that in here as well. Do I have admitting hospital privileges? If you have any of that, any arrangements, blah, 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 then you want to put that in here. But I don't. Now, this is where it gets really important as well because you can designate a credentialing contact. And a credentialing contact would get in my credentialing professionals that are on this intro video. You already know what this is, but I'm speaking for my providers that want to be proactive and establish their own CAQH and keep the maintenance up with it. Then you just put in all this information for your credentialing contact, or if you have a contact and you are establishing this profile, then the credentialing contact will know to go back in and add their information. And if any of my credentialing colleagues did not know that, now you know. Okay, here's where you maintain your PLI, which is also your COI, which is also your malpractice insurance. And then here, you would just, if I say yes, it's going to say yes. Then I need to add in my liability information. This is a big one that everyone always has a problem with. Some tips when you are uploading your PLI, please make sure your name is on the insurance certificate. I have seen CAQH come back to deny that upload because the provider's name was not on there. That is the key thing that CAQH will return your document upload. And if you are a credentialing professional, you know we hate return documents in the CAQH profile. I mean, I hate them. I just want my CAQH providers, my provider CAQH to be done and complete and don't worry about anything. So that is the most, that is the hugest tip. And also, you want to make sure the policy number is on there. That's another big one. Sometimes I've seen them deny because it didn't have an expiration date because some of my providers' policies did not have an expiration date. So sometimes they would deny for that because some of them are not credentialing professionals, unfortunately. So they aren't all the way skilled in the credentialing side of things. So as I stated, this is more of an enroll to me for in my personal opinion. I feel like CAQH is definitely geared more towards the providing enrollment size of things, less for credentialing, but I think they are trying to make it a standard where in some organizations may be out there that actually take the CAQH application as their credentialing medical staff application. But I haven't interacted with anyone that do that yet. I'm going to just put no here because it's just going to deny anyway. And if you have some employment info, you do that here. If you have any active military duty responsibilities, then you go ahead and put that stuff in here. If you have references, it's good to put in references, but it's not a requirement. So I usually don't complete references for my providers, but it is good to have it in there if you have one or two. But like I just previously stated, they are trying to adapt this into more of a medical staff application too, I believe. So now the disclosure questions are very important. So remember those state mandated applications that we have that ask the certain questions about licensing. Has your license been revoked? hospital privileges, education, DEA, Medicare sanctions, PLI, and this is the malpractice. If you've ever had any malpractice claims, that information will go here. Criminal history and all that good stuff. I'm gonna just skip that for now, but you may complete that on risk. This is another important thing. You always want to release your data to any organization that requests access, because if you don't, every time this will delay your enrollment. If you are using CAQH, this will delay your enrollment because the payer will either try to send you an email to allow them to access your CAQH, or something else weird, and you just don't want that to happen. You want to be in the enrollment process for as little time as possible. So always release your data to the organizations that request it. And then that's safe. Now, if you have completed your profile and it's complete, and that means answering all the questions with asterisks on them, then you'll have here where you have your application data and your supporting documents. Here is all the errors, and we know I'm going to have errors because, like I stated before, I don't have a lot of that information, but we can just look at some of those errors. So you see it actually does a check for the MPI, and you can see that can't be found. I didn't have a social that I could put in. And then you'll just see all of these, and I didn't answer any of the disclosure questions. So CAQH is really good about that and letting you know what you didn't complete. So I just want to go back to where I was. And supporting documents, I'm missing 2 documents, obviously. And that is going to be the application of release. And if I didn't have insurance, I would need to upload a letter explaining why. So the application release is from CAQH. And we're just going to open that up and see what that looks like. This is what that looks like. This will need to be put in, and it'll need to be completed. I don't know if they have resumed accepting electronic signatures on this form, but what we're doing is having to tediously have our providers physically sign this and send it back over to us, which is the most tedious thing I've ever heard. So if you wanted to upload a specific document, you would do that here. If I had in my license information and everything, then it would let me, I would probably want to put in a copy if I have it, but those are some of the things that they just aren't asking for anymore. So now I'll go back, and then I can review my data. And in our CAQH pilot program, we always send this copy to our providers when we are attesting for them on their behalf. We always send this to them for them to review, because we don't want to assume the responsibility that they're still working somewhere, and we just want to prevent any inaccuracies. So we always put this in an electronic signature file. Our provider signs it, they review everything on their phone, and they can just put in a yes, everything is okay. So we have a signature for that provider saying that all this information is accurate and nothing has changed. Next, I can download my application. And I can include, this is what I was talking about earlier, where I can download my state mandated application if I want to download it. And then now that's going to download. And I'm in South Carolina, so they have a state mandated. So here it populates all that information in a format. And like what I just said, the data summary, you can either send the data summary or you can send this state mandated application. But I think the data summary is easier on the eyes because when our providers open this and look at it, they're just like, oh, that is so much information going on. And everything is just so small. The data summary is definitely more user friendly and your provider will sign off on it in no time. And we put this in electronic signature because we want to know when our provider opened it, when they viewed it, when they signed it, and we want to know that what's in here is accurate because we're reattesting for them. Unfortunately, CAQH does not have a surrogacy program like Medicare has where they can give surrogacy to the consultant or the credentialing staff professional to complete this profile for them. All right, so that pretty much sums up everything. We've covered the entire CAQH profile. You have your home profile data. That was everything that we did. Documents, this is where we upload our supporting documents. You can also get to that from this tab. And authorization was where we went and we wanted to authorize all payer organizations to download our information so that it can rapidly speed up the provider enrollment process. So, for instance, if I had everything ready to go and all of this was green, and what I mean by green is that your profile data would say complete and it would be in a green format, and documents would say green and would be green and it would be in a complete status. So that's what it would say here and here. And your provider status is it'll tell you just where you are. Now with CAQH, what I did not mention before is you have to reattest to your information quarterly. And I think that isn't excessive. Many of my colleagues may object with me on that, but I think that it's very accurate because our providers bounce around so much. We never can really keep a hand on them because they're always getting into so many different activities. So once we download that data summary and everything and send that to our providers may or may not say, hey, well, I'm actually practicing at ABC cardiology as well as ABCD cardiology, but can you update my CAQH with that information? And we would obviously say, yeah, sure, we can do that for you. And now let me just go back to the provider status. Since this is my first time logging in, this is why it has a status of first provider contact, because today is my first profile and there are different statuses. So if it's time for you to reattest to your information, then it will have a reattestation status here. So now I'm going to review and attest. It may not let me attest either. So it won't let me reattest because I have all these errors, and we do not want your profile to look like that, and your profile will never look like that. So I can't reattest. So this is a good thing. CAQH kicks it back to you and says, no, you can't go forward because you have all these errors that you need to identify. But ideally, I would go to review and attest, and it'll bring up another screen where I'm just checking my information as well, and then it'll let me attest to the information, basically saying everything I've put in this application is true. Here's a new little button they have added, which is this alert button. And I assume this just gives you alert about your profile. May do something different. I'll dig deep into that to let you guys know. If you want to change your password activity, here's another cool thing, the activity log. You can actually see what's been done on your profile. So if you see, it'll tell you everything that someone has changed on your profile. You can go here, not what someone has done, but the provider, or if you have a surrogate, which would be someone that's acting on your behalf and completing your credentialing information. So, guys, that about sums everything up. I hope this information has been informative to you. If you have any CAQH questions, I'm always available. If you would like to adopt our CAQH pilot program where we maintain your CAQH and we also implement that strategy with your healthcare organization, feel free to send me an email at KENTESHA at philosophy.com. I can't wait to hear from you. And if you have any comments about this video, anything you feel that anything you feel that I can elaborate on, please feel free to drop it down in the comments or just shoot me an email as well for me to elaborate on something for you. And I don't mind doing that at all. You guys have an amazing day. Bye for now.